Okay, so the first quote that I pulled from chapter 1 was on page 13, and it's talking about negative religious coping. I've never really thought about how that could impact my practice. I think most of the time I think about how like different religions could come in and how I would react to a different religion, but I've never really considered like negative thoughts that may be at my religion and how I would address that. And how it could impact someone's health because of the decisions and religious beliefs that they have. And so in the quote that I pulled, there's 3 different things it talks about, and the third one stood out to me. It says, the practitioner-client relationship may be compromised if the practitioner or client has difficulty relating to the other when spiritual and religious values are not consistent or compatible. And I think it's gonna be hard at sometimes to like not like preach when you maybe don't agree with somebody or don't like how they're speaking about your religion. And so I think that's gonna be something I'm gonna have to consider and work through as I go into my practice and how I'm gonna like really determine how I'm gonna go about that situation. Okay, so for part 2, I put from page 101, and the quote that I put was, thus the process of giving meaning to occupation involves a connection between a person's identity or self-image and the engagement of select occupations. And I thought this was meaningful to practice because I've never really connected identity and occupation. And I think when someone's lacking that identity piece, it can be really hard to figure out what they enjoy doing because they themselves obviously aren't even sure. And I think even from like a personal level, I haven't even figured out how to address it in myself because I feel like my whole life my identity's been like I'm a volleyball player and that's all I've really ever done and practiced. And so it's been interesting throughout school trying to figure out kind of like what I enjoy doing and what I put my identity in. So I think going forward in practice, it's going to be really important for me to kind of learn how to do that within myself so I can help patients in the future when they have lost a part of them that they no longer participate in and what that means for them and their self-image and their identity. So for part 3, I pulled from page 181, and in this section it's talking about 2 different strategies or 2 questions that therapists often use to hear what the client is trying to communicate. And those 2 questions are, what is the client intrinsically motivated to do, and what are his or her internalized motivations? It goes further and says, listening for these motivations provides a safe space to pursue wholeness while helping to identify meaningful therapy goals. And when I first heard that, I was thinking about identity when I read it in part 2. And now when I think of identity, I kind of think of wholeness and how like having good identity and self-image is kind of like feeling whole and complete. And so it made me think about how motivations can help identify those meaningful therapy goals to lead to like further engagement in occupation. And I think that will be important in the future practice, is so I can help and ask these questions to pursue wholeness so that people can really truly dive into their identity and their sense of wonder and engagement in different occupations to pursue those meaningful goals that they have in tasks.